or Georgia Hospital told its workers if they're not showing any symptoms to go ahead and keep working without even knowing if they had tested positive for the virus. But again, they didn't show symptoms. So that sparked backlash from people's loved ones and from those employees themselves. An 11 Alive exclusive for you tonight. Faith Abube shows you why that policy changed after we started asking some tough questions.
The problem is that until that patient's test comes back positive, nurses are being told to take care of that patient without any protective equipment.
A Georgia nurse says she's worried healthcare workers are being exposed to COVID-19 on the job, and hospitals are having to make tough decisions because of a shortage of vital medical equipment. And now a memo to hospital staff at Phoebe Health in Southwest Georgia on Monday is raising even more concerns. The letter, posted on social media, says the Department of Public Health requires all healthcare workers to be tested for COVID-19, even if they're not showing any symptoms of the virus. And even if they do test positive, they should continue working as long as they're symptom-free.
We had very long, animated conversations with the local health department, with the state health department, asking them to reconsider, discussing what position this would put us in and would put any healthcare organization in. And unfortunately, they felt like they were under a federal mandate to do that.
Scott Steiner is CEO of Phoebe Health.
The CDC still recommends that you can work as long as you wear a mask the entire time that you are working. Because if we don't have nurses and doctors, tell me who's going to care for our patients.
The nurse at another Georgia hospital echoes concerns about the work requirements.
Am I an asymptomatic carrier of the virus being told to still work? If what we are being told is if we are not showing symptoms of infection, we should still work. And that's regardless of how great our exposure has been.
It's not a perfect situation.
Steiner says DPH signed off on the original memo to employees, requiring them to keep working even if they test positive for COVID-19. DPH tells The Reveal it was a mistake that unfortunately was not caught in the approval process.
And that's the other piece of this. Everybody's looking for the exact right answer, and there isn't one. I'd love to be able to say, hey, if you've tested positive, go home, take whatever it is, 7 days or 2 weeks. But again, remember, we have to run a hospital here. Otherwise, we would have to shut down. And most organizations are in that same position.
Concerns about the original memo has now forced changes at Phoebe Health. And because the CDC is giving local authorities some flexibility to avoid staffing shortages, DPH says once confirmed as positive, any staff member must be excluded from the hospital and remain in isolation per routine protocol. They should only work if they're asymptomatic or waiting for their COVID-19 test results and have proper protective gear.
We are operating by the best information that we have from the CDC, other agencies, and just again, trying to make sure that our staff is safe, that we're taking care of them, and that we're able to focus on taking care of all of our patients.
Kelly Halsey with Piedmont Health says if employees are not showing symptoms, they can still work, but they are not being tested until they show symptoms. Emory and Grady Hospital also say they are not testing healthcare workers who are not showing symptoms. Children's Healthcare and Wellstar say employees can stay home if they show symptoms. In a sea of muddled messages, all the healthcare workers we talk to say they're still doing the best they can in a growing pandemic. At Phoebe Health, once a staff member is exposed to the virus, they can only work with COVID positive and suspected patients.
What we tell our patients is that their safety and their health care is our most important item, and that we would never put them intentionally at risk, that the measures that we have put into place to protect them and to protect our staff, to protect our doctors, are what the CDC and the experts have recommended.
So Phoebe Health says several hundred workers who did not show symptoms did ask to be tested. They are now waiting for those results to come back. So Faith reached out to the CDC to see what exactly are the return to work guidelines, and they say that should be left up to local health departments and the hospitals there.